My name is Allison Sanders, student ID number 3266053, and this is my week 9 AVMA test video for VTHT 2223, and I'm going to be showing how to do a coagulation test. So today we're going to go over how to do a fibrinogen assay. So to kind of get things started, you're going to do the same setup you would doing a PCV or total solids. So you're going to take your 2 hematocrit tubes, you're going to fill them up about 3/4 of the way with blood. And then you're going to dip them in the clay twice. And then you're going to do the same thing with the other two. Again, dip it in the clay twice. And then you're going to spin them down the same way you would do a PCV or total solids. You're going to make sure the clay is sticking outward. I'm going to make sure they're balanced. And then for our machine, you spin it for 5 minutes and you spin it on high. So then we'll come back once our results are in. Okay. So now that it's been 5 minutes, our tubes are done centrifuging. So we're going to go ahead and take them out. And the next step in doing this is we're going to take one of the tubes and we're going to put it in our incubator. And we have our incubator set to 58 degrees Celsius. And this has to stay in the incubator for 3 minutes. So then we'll come back once the 3 minutes are done and we'll recentrifuge this one, and then we'll get on with the fibrinogen assay. So it's been 3 minutes, so we're going to go ahead and get the hematocrit tube out of the incubator.
And then just give us a call when you get here. We'll do payment over the phone and bring it out to you, okay?
And then you have to recentrifuge this. So you're going to balance it out again. You're going to get the total solids and PCV of the other one. So you're going to take that out, and I just went ahead and did another hematocrit tube. That way they could be centered and balanced. So you're going to go ahead, shut that. Tighten it, and then go ahead and respin this again for 5 minutes on high. And while that's spinning, we're going to get the PCV and total solids of the other one. Go ahead and line the thing up. And the PCV is about 45. The total solids, go ahead and break it. Dab some of the plasma on the refractometer. Shut it. Nothing to light. And the total solids is about 7.5. Okay, so our incubated hematocrit tube just finished respinning. So now we're going to take that out and get the PCV and total solids of this as well. PCV of that is 46. total solids is 7.3. Go ahead and write that down. So the 7.5 and 7.3 give you grams per deciliters, but to do a fibrinogen assay, they have to be in milligrams per deciliter. So you're going to multiply those numbers by 1,000. So for the 7.5 for the non-incubated tube, hematocrit tube, it's going to be 7,500, and for the incubated tube, it's going to be 7,300. And then to find the fibrinogen assay, what you do is you do the 7.5 minus the 7.3. So we did the subtraction, so 7.5 minus 7.3 would be 0.2, and that's low levels of fibrinogen. So it could mean that my patient either has like potential bleeding or liver issues or something like that. So we'd recommend sending the blood out for further testing and get kind of a better knowledge of what's going on. But the 0.2 gives us the milligrams per deciliter, and it is a very low percentage. So unfortunately, we would have to send it out and see if there's anything else going on with our patient.